Now we are going to discuss about the congestive cardiac failure. So general instruction in the CCF are: take bed rest. Patient should take bed rest in the sitting position with cardiac table. If patient is dyspneic, patient should take oxygen by nasal catheter. If patient is dyspneic, patient should take salt-free diet. Avoid heavy meals. Salt-free diet because excessive salt intake retain the fluids in the blood vessels and body, leads to the afterload, increase in the afterload on the left ventricle. So it leads to the worsening in congestive cardiac failure. Restricted fluid intake. Patient should avoid NSAIDs. Patient should take vaccines like pneumococcal and H influenza. Basic treatment in the CCF is tablet Lasix half to 1 daily till edema subsides. Then tablet 1 or 2 times every week patient can take. Tablet Lasix is a diuretic which reduces the body fluid in the body and leads to decrease afterload on the left ventricle. Next is a tablet Cardiovas. It is a 3.125 mg BD. We can use up to 25 mg BD. It is a beta blocker. Beta receptor present on the heart and it directly work on the heart. It contains the cardiolol, so it decreases the blood pressure and leads to the relief in congestive cardiac failure. Next is the tablet Cardace 1.25 mg. We can take OD or BD. It contains ramipil, which is AC inhibitors, which remove the excess water fluids from the body through urination. Next, we should start ACB inhibitors to the patient if patient is asymptomatic. Like अगर पेशेंट असिम्टोमेटिक भी है तब भी हम पेशेंट को ACB इनहिबिटर्स स्टार्ट करनी चाहिए अगर बीपी बढ़ा हुआ है तो, लाइक रैमिप्रिल, इनरवेल और कैप्टोप्रिल. We can give patient a tablet linoxin 1 daily for 6 days per week. A linoxin tablet is the content of it is digitalis. So there is no loading dose of digitalis in congestive cardiac failure. We should watch pulse for bradycardia or irregular rhythm after giving digitalis to the patient. Start linoxin if symptomatic, if ejection fraction is less than 35 and if arterial fibrillation present. Next, additional treatment for the congestive cardiac failure. Tablet Imnit 30 mg OD if associated ischemic heart disease or pulmonary congestion. So Imnic tablet का कंटेंट क्या होता है? मोनोनाइट्रेट. नेक्स्ट वी कैन गिव टैबलेट डाइटर 10 mg OD if severe that is class 3 or 4th heart failure present. Tablet diator content torsemide, so which is used for lowering BP and remove the fluid outside the body. If the diuretics is to be given for more than 5 days, give potassium sparing diuretics like Lasix plus amiloride, Lasix plus spironolactone or torsemide plus spironolactone, because the diuretics leads to the loss of retention of potassium in the body and loss of sodium from the body. It leads to the hyperkalemia in the body. So for countering such condition, we give the amiloride, like we give the potassium sparing diuretics to counteract it. Tablet we should give tablet Campos 5 mg 1 BD in acute phase, which is a tranquilizer, so which are used in the as an antipsychotic patient, but tablet Campos can be used in the congestive cardiac failure. Next we can use tablet Ortorin 1 OD till HB is normal. Tablet Neurolax half or 1 sachet daily if constipation present. The Naturolax sachets contains Ispagula laxative. Also it is present as a in the medical as a xylem husk. We generally know about it. So next is If acute exacerbation and breathlessness present, then we should give injection aminophylline or injection derifylline. We give injection aminophylline with 25% glucose, 10 cc each, slow IV. Aminophylline and derifylline are the bronchodilators, so which are used for the acute exacerbation and breathlessness to control it. Next, we give injection Lasix 2 ml. In such condition, IV slow stat or SOS according to the situation. We can give injection Cetils 750 mg IV 8 hourly, which is antibiotic for respiratory infection. Next, we can use oxygen nasal mask for the oxygen. We and in certain conditions where the condition is becoming critical, we should refer the patient to the cardiologist for ICCU management like dopamine nitroglycerin. If renal dysfunction is there or dialysis and ultrafiltration is required to remove the excess fluid, then we should definitely refer the patient to the cardiologist or higher centers. Next, in severe refractory CCF, अगर ejection fraction is less than 40%, then we should go for the biventricular pacemaker and implantable defibrillator. In select centers, such patients are considered for cardiac transplant. If ejection fraction is less than 40 and implantable defibrillation or the pacemaker is not going to work, then such condition we go for the cardiac transplant for the patient. So in such conditions, refer every patient for of congestive cardiac failure to a cardiologist for detailed investigation, echocardiography, or in suitable cases corrective valve surgery. Give the treatment under cardiologist guidance. If patient on linoxin complains of nausea, stop linoxin for 2 to 3 days, because linoxin contains digitalis, which is a cardiotoxic. That's why if this patient is present with nausea, then linoxin can be stopped for 2 to 3 days, then start again 1 tablet daily. If pulse is less than 60 per minute, or if new irregularities develop in the pulse during treatment, then the tablet linoxin, which is digitalis, should be stopped. If the cause is rheumatic valve disease, advise injection PP4 intramuscular ATD for 21 days. Next is, if there is a left heart failure, AC-meter plus diuretics should be given, and if the right heart failure, linoxone plus dopamine and nitroglycerin should be given. So you can ask the question like, why the AC inhibitors and diuretics is given in the left heart failure, and why the linoxone, dopamine and nitroglycerin given in the right heart failure? Because in the left heart failure there is a load on the heart left ventricles, and AC inhibitors and diuretics decrease the load by removing the excessive fluid in blood circulation from the body, which leads to the decrease in afterload on the left ventricles. And in right heart failure, there is a right heart failure there is a load on the right ventricles, in which if you give nitroglycerin and dobutamine, it leads to the vasodilation of the vena cavas and the veins, which gives deoxygenated blood to the right ventricle or right atria, which leads to the reduce in symptoms in right heart failure.